way. Drea, would you stand here and lean forward? Let's give you a nice adjustment right now. We do a special technique at the center. Are you ready?
Yeah.
You're going to feel yourself move forward. And I utilize a handheld instrument. I also use my hands and do more traditional methods. But today we're going to do some pain therapy because she's been hurting a lot. And I'm using an instrument that puts out an impulse of 40 hertz, and I'm gently realigning the vertebrae. Is this or this tender?
No.
So she has no tenderness there. How about in here?
No.
We're very thorough at this center. We start from the bottom and move up because, let's face it, most of us suffer from chronic lower back pain. And I'm going to check Drea's hips and make sure that they wiggle in and out easily, and they do. And she's young and spry, but she does have a discal protrusion in her neck. And I'm going to go directly to the neck area right now and feel the various vertebrae in the neck, and they're not moving properly. When I push on them, they offer a lot of resistance, and they shouldn't. And I'm going to use this instrument to gently realign the vertebrae in her neck. Drea, would you turn your face to the left for just a second and tell the audience, does that hurt to get adjusted?
Oh, no, not to get adjusted.
All right,
No.
I know your
Not at
neck
all.
hurts. But
Yeah.
bring your head back in the center. But to get the process of getting care is virtually painless, I'll point out. And she'll testify to that. In her neck, I'm going to do some more traditional moves here because she's so stiff and locked up. It's imperative that we get her spine moving correctly, and I'm going to work on the muscles, the levator scapula in particular, the upper trapezius, the scalenus anticus muscles, and I'm feeling with my hand on her mid-back. I'm looking for areas of inflammation. And I'm gently realigning the vertebrae using an impulse that's virtually the same frequency as the human body. We vibrate at about 40 hertz, scientists and doctors say. So we can use that harmonic to get people realigned, rehabilitated, and strengthened, and take pressure off the delicate and sensitive nerves. I'm going to do a nerve test right now. And I'm checking her alignment. I'm examining her legs. I want to make sure that one leg is just as long as the other, obviously. Shrug your shoulders toward your head. Relax, that's good. And the feet are even here, and they're even here. Lift your head up when you can. Relax your head. Once she does that, her right leg shortens, and it shouldn't, and it lengthens as I lift it. So that tells me that her neck is out of alignment. We're subluxated. It's causing discal protrusion and driving her nuts. Is that true, Drea?
Very much.
Very much so. Tuck your chin toward your chest. Relax. If you've ever had a discal problem, it's painful, whether it's in the neck or in the back. Look over your left shoulder. If you've had a discal problem in your lower back, you know it affects the legs. But in the neck area, of course, it interferes with the nerves that go down our arms, head in the center. Roll over now on your back and please face up. Go ahead and face up. And I'm going to do a more traditional adjustment in her neck. And Drea, you might feel a click as we gently realign the vertebrae. Bring your arms to your sides. But first I'm going to use my hands and I'm going to work the muscles because she knows they hurt like holy heck, right? Especially in here,
Yeah.
Drea.
Yes.
You're having a lot of trouble with this one right in here.
Yeah.
Where the muscles insert into the scapula. It hurts a lot, and it kept you up last night, right?
Yes.
There we go. And she's a busy lady. She's got a young son that she's doing a great job with. In fact, he's kind of a hero. There we go. And I'm going to realign her neck by hand. Relax your head and neck. There we go. Baby, those muscles are sore. I could feel the capsules of the joint are inflamed, and she's definitely out of alignment here. The nerves from here go into her arms, hands, and fingers, go down the legs. And as I rub her neck, you could even feel it down your arm, can't you?
Yeah.
I'll bet you can. So, Drea, look over your left shoulder. Relax. Let your head and neck go. Let this muscle just relax. Let your head go all the way. Just relax. And That's the way. You adjusted like a princess. That was beautiful. Open your eyes and tell the audience how that felt, because they're wondering, how does an adjustment feel?
It doesn't. You don't feel the adjustment. You just hear it, baby.
All righty. When you can, go ahead and lay belly down again. We're going to do some acupuncture today. I'm a qualified, state-licensed acupuncturist as well. And I'm going to use sterile needles today. And these needles are sterilized, and they're single-use needles. And I'm going to use the acupuncture points corresponding with her problem. I'm going to use acupuncture today. Andrea, does that hurt at all?
No.
You ever have acupuncture before?
No.
So this is something different, right?
Mm-hmm.
You might feel a dull sensation or a traveling sensation with that, but it's relatively comfortable. Is that true?
Yeah.
Right. I'm going to use the acupuncture points involved with discal protrusion. Here we go. People wonder how it might feel. Is it painful?
Not what you're doing.
I know you've been vaccinated.
Yeah.
Is it as painful as vaccination?
That actually probably hurt more.
That probably hurt a lot more. In Asian medicine, they use the law of opposites. And the law of opposites says you go to the opposite side of pain. Now you have pain down your right arm, is that correct?
Yeah.
I'm going to go to the left arm today and do a special point. And this is one of the most commonly used points in acupuncture. It's LI4, large intestine 4. Each one of these points has a name in most instances, and I'm going to stimulate that point on the left side because it's going to help the right side of the body. There's a balance. There's a yin and yang inside of us, a balance that keeps us healthy. And by going to the opposite side, it'll work magic on the right side where she has the pain. Are you comfortable there, Drea?
Yeah.
We're not going to wait the whole 20 minutes on the film, but that's about how long it takes to get the anesthetic effect. And I wanted to show you some more things we do for Drea. I want to let her all the way forward. And one of the things she really likes is the massage instrument that we give each patient when they come in. How does that feel, Drea?
That's good.
When bones are out of alignment, muscles get tight and people suffer. And I'm going to work this area between the shoulder blades. And she has, how old is your son, Hero?
He'll be 6 in a couple weeks.
She's got a little 6-year-old working on her too.
Yeah.
Using the same device, so it's not that complicated, I'll point out.
Yeah, he likes that thing.
He likes that thing. Dr.V likes it too. Here we go. And we'll work these areas where the muscles are. So if vertebrae are crooked, what happens is muscles tighten up and go into spasm in and around the joints to protect those joints. And it's followed by inflammation and swelling. And I'm using a handheld instrument. How does that feel, Drea?
It's okay.
Yeah, good. To rub her spine, and we'll do a little rub-a-dub-dub today. And then I'm going to use some extra points here where the disc is. It goes down her arm. And you'll get to see that as well. So acupuncture involves very specific points in the body. And these points, scientists and doctors now know, release chemicals in the body, like endorphins and enkephalins, that help with pain and pain reduction. They occupy, these chemicals occupy the same sites as opioid medications, but these needles have no drugs on them, and they're sterile. And we're going to use the acupuncture points associated with discal protrusion. How you doing there, Drea?
Good.
How's that feel?
It's
Is that
fine.
comfortable?
Yeah. I mean, as comfortable as I can be.
Obviously. All right. For the full anesthetic effect, it takes about 20 minutes. And I'm taking these needles out right now. We've given her first acupuncture treatment. We'll get to hear from Drea how she liked it. But we send these needles to be destroyed at a special lab. We only use them once. I'm going to stretch out the muscles that go from her neck here to her shoulder, because the levator scapula goes to the upper corner of the scapula and to the third cervical vertebra. And if I stretch her out like this, it feels pretty darn good, right, Drea?
Yes.
There you go. And so these are things that you could do at home. You could use ice in the meantime. You can have your son rub right in here. This is good for that too. He's a good guy. And you could stretch out your shoulder in the shower and pour hot, moist heat here. Never use dry heat on a problem like this.
Okay.
And go ahead, turn your face to the right. And I'm going to lift you. If you've watched the video this far, I want you to comment, like, hit that red subscribe button. Click on the notify bell so that I can send you the latest videos from my center. And unlike other doctors, I don't use models. These are real patients with real problems. I'm not using models like other doctors do. This is a real case. You've got some real pain,
Yes.
right? And it's a tough case too. But how does that feel overall? How have you been doing?
The pain is a little more dull. It's not as sharp as it was, and I have a better range of motion right now.
Okay, so you're moving better and you're feeling a little bit better.
Yeah.
And she knows that this is going to take time. That all healing in the end takes time, but you're well on your way. What
Yeah.
have you noticed overall with care?
Just that I do feel like it's helping. I still feel pain, but it's always like a better pain, if you will.
All right.
So,
It's a process that you're
Yeah.
involved with, and you're getting things straightened out, and that disc is healing up. And usually that's going to take a few weeks.
yeah.
Compared to the way you started, where do you think you're at as far as the level of pain is concerned? What was your pain like when you started care? On a
Like
scale of 1 to 10.
like a 12.
Like a 12 on a scale of 1 to 10. So it's off the charts pain, right?
Yeah.
And what kind of pain are you noting right now?
Right now, maybe like an 8 or 7.
Okay.
It's dealable.
All right. But she just started with care, and
Yeah.
she's on her way. And I wanted to thank you very much. But what would you tell people with cervical discal protrusions or bulging disc in the neck? What would you tell them about chiropractic care and what they could do about it?
To come and see a chiropractor before you see the surgeon.
There you go. So you could avoid the knife, right?
Yeah.
Because the next step is drugs and surgery, and all the drugs have side effects, and the surgery is dangerous.
Yeah.
I wanted to thank you for telling the folks about chiropractic care, and invite you to share if you care, comment, hit the red subscribe button, and click the notify bell so you get the latest information from Care Chiropractic.
Thank you.